Over the years, I have played some characters you could call controlling, but the truth is, there's so much in life we can't control. But here's something we can: colorectal cancer. It affects men and women, and it's the second leading cancer killer in the US, which is astounding, considering it's almost entirely preventable. Here's how. Most colon cancers start as polyps, and screening helps find polyps so they can be removed before they even turn into cancer. Screening also finds this cancer early, when treatment works best. For me, screening was simple and quick. It was no big deal, except for the huge sense of relief you feel afterwards. There are several tests that you can choose from. If you're 50 or older, you should talk to your doctor. Decide which one's right for you, but take control. Do everything you can to prevent colon cancer. Screening saves lives.
Hello and welcome to the Health Storm Center. I'm Dr. Manning. According to the CDC, colorectal cancer is the second leading cancer killer in the U.S., but if people got a regular screening, as many as 60% of deaths could be prevented. So if you're 50 or older or have a family history of colorectal cancer, you should begin screening at regular intervals. Colonoscopy has become the preferred choice by doctors to screen for colon cancer. Now let's go into the body to see how a colonoscopy is performed. You will need to follow a bowel prep diet 24 to 48 hours before your colonoscopy. Before the procedure, you will be given an IV line for sedation, and your vital signs will be monitored as well. The procedure is performed using an endoscope, which consists of a long, flexible device with a light and video camera at the end. The endoscope also has instruments to perform biopsies and remove lesions. Now, here's the wide view of the large intestine. In some procedures, the doctor will only inspect the top of the descending colon. This is called a sigmoidoscopy. Now, in a colonoscopy, the endoscope reaches the entire length of the intestine to where it connects with the small intestine. During the test, your doctor will be looking for abnormalities in the mucosal lining of your gastrointestinal tract. These can be polyps, inflammations, or infections. This procedure is also done to diagnose unexplained intestinal pain, rectal bleeding, or a change in bowel habits. You may experience cramping or gas pain during the procedure. This is normal, but you should alert your doctor to any discomfort. Your doctor may find it necessary to take a biopsy. This will help distinguish between cancer and benign disease. Biopsies can be taken even if your doctor does not suspect cancer. If one or more polyps are discovered, your doctor will generally remove them in a procedure called a polypectomy. Usually a snare will be used to remove the polyp, then the base will be cauterized to control the bleeding. After the procedure, you will be monitored for about half an hour until the effects of the anesthesia wear off. Also, you will need to arrange for a ride home, especially if you get a full colonoscopy. Some of the other colon cancer screening tests include taking a yearly stool test to detect the presence of blood. If blood is found in the stool, a follow-up colonoscopy is usually performed. Also, there is an option for virtual colonoscopy, which is less invasive. But as always, you should always consult your physician for the best option for you. I'm Dr. Manny, Fox News.
We congratulate you on your decision to take the fecal occult blood test. We congratulate you on your decision to take these measures to try to stay healthy and to live your life to the fullest. This is for the benefit of you and for the loved ones around you. Now all you need to do is smear your own poo on a card and mail it to us. Yes, we know. We do not expect you to enjoy this process, but it is a great way for you to screen for colorectal cancer. The pros far outweigh the cons, so please bear with us. Now your poo, of course, has a variety of different names, some of which are rather non-technical, but for the purposes of this video, we will continue to just call it poo. Now, while you're taking this test, you can eat and drink as you normally do, except for citrus fruits and juices. Do not eat or drink anything citrus starting from 3 days before you take the test until the time you've got your samples in the mailbox. This includes all vitamin C supplements, oranges or grapefruit, and orange or grapefruit juice. This is your poo collection card. As you can see, it has 3 separate flaps for the 3 different samples you will be taking. When you feel the urge to make poo, fill out the date and time on the first flap. If I were you, I'd make sure to fill out the card first, as it may be sort of icky to do so after you've smeared poo on it. Now we need to prepare your toilet. Your toilet water needs to be clean with no chemical agents in the water. If water blue, no good for poo. Now take a sheet of plastic wrap or a few layers of paper towels and float this on the surface of the toilet water. Allow it to stick to the sides of the toilet bowl. You are now prepared to have a bowel movement. Put the seat down, sit on it, and let her rip. When you are done, lift up the flap of the poo collection card and you will see these 2 boxes. Take one of the applicator sticks and take a small sample from one part of your poo and smear it on the first box on the card, and then take a sample from another part of your poo and smear it in the second box on the card. Now here's the part you were waiting for. Throw the little stick away, remove the plastic wrap from the toilet and throw that away. You can now flush your toilet, and I wouldn't blame you if you wanted to take out your garbage now either. Anyway, repeat this process with the other 2 poo sample tabs over the next few days whenever you need to have a bowel movement. But just make sure that you collect all of the samples within 7 days. When you have all of the samples, seal it up and send it to us. Whatever your background or medical history is, screening for colorectal cancer will help keep you happy and healthy. So don't delay, specialists are standing by now, looking forward to looking at your poo.